My guest on this episode talks about what it means to turn survival into strength and dreams into disruption. She shares how standing in her worth, even when the world tried to shrink her, shaped a life of purpose, lifting up communities, building systems of support, and daring others to choose their own disruption. Our conversation is a testament to the power of resilience, vision, and unapologetic hope. You're listening to the Courageous Public Health Podcast, Episode 3. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'm so excited to introduce you to my guest. But first, I'd like to reintroduce myself if you're brand new to the podcast, or reintroduce myself if you're a returning listener. My name is Dr. Christy McClamrock, and I'm an epidemiologist, public health entrepreneur, and the CEO of the Courageous Public Health consulting firm. At Courageous Public Health, we are turning up the volume on courage within women, particularly Black, Indigenous, and women of color, who are doing the work of public health. We support public health organizations through workshop design and facilitation and speaking engagements. Be sure to subscribe to the Courageous Public Health Podcast email list. The link will be provided in the show notes. I'm so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Dr. Raymona H Lawrence is the founder and CEO of Dr. Raymona H Lawrence Coaching, LLC, where she is a dynamic keynote speaker, corporate trainer, and consultant. Her life's work and heartfelt mission is to challenge broken systems that keep people from reaching their highest potential. Therefore, she uses evidence-based principles of community engagement, diversity, equity, and inclusion, and psychological safety to curate transformational change strategies within teams and companies. Dr. Lawrence also delivers engaging and thought-provoking speeches and trainings to thousands of individuals across the United States and globally. She has facilitated diversity, equity, and inclusion and psychological safety training and consulted with companies such as Arbonne International, Rodin and Fields, Forma Therapeutics, the Georgia Council of Court Administrators, the National Association of Graduate Admissions Professionals, and Novo Nordisk. Dr. Lawrence is highly intrigued by the breadth and depth of human difference and is passionate about helping individuals and organizations develop curated strategies to connect to diverse communities, customers, and team members. Dr. Lawrence has a doctorate in public health, extensive training in community engagement, health disparities, and health inequities, and has a certificate in diversity and inclusion from Cornell University's eCornell, is a qualified administrator of the Intercultural Development Inventory, has a certificate in the Intercultural Conflict Inventory, and holds the Certified Diversity Executive Credential. Dr. Lawrence was recently promoted to the rank of full professor of health policy and community health at the Jian Ping Su College of Public Health at Georgia Southern University. Her main research focus is community engagement in rural, hard-to-reach populations, especially those with sickle cell disease. Dr. Lawrence has been an investigator on numerous rural health and sickle cell disease-related grants. She is currently a dual principal investigator with Dr. Ife Osunkwo, now Payal Desai, on a $9.7 million Patient-Centered Outcomes Research Institute grant entitled Comparative Effectiveness of Peer Mentoring versus Structured Education-Based Transition Programming for the Management of Care Transitions in Emerging Adults with Sickle Cell Disease. Dr. Lawrence is an award-winning coach for the National Center for Faculty Development and Diversity. She also serves as a director of research for the Sickle Cell Community Consortium and is the editor-in-chief of the Journal of the Georgia Public Health Association. Dr. Raymona H Lawrence seamlessly bridges academia and entrepreneurship, combining her expertise in community engagement, psychological safety, and DEI with her passion for empowering professionals through effective systems. As the founder of the Systems Boutique, she supports authors, speakers, coaches, and consultants in streamlining their businesses with innovative systems that save time and reduce overwhelm. This dual focus allows her to advance academic research while offering practical solutions that help professionals bring their ideas to life and thrive in their work. Let's connect my conversation with Dr. Lawrence right now. Hello. I'm so excited to have you here. It's such an honor. I want to introduce Dr. Raymona Lawrence, aka Dr. Ray Hala, Her Excellence. So happy to have you. How are you? How are you doing?
I am great. Thank you. And I think we probably need to give a little backstory as to why you call me Dr. Ray Hala, Her Excellence. And so we met at the Women's Leadership Institute for the American Public Health Association. And I was there doing a keynote speech on mentoring and how you can use your superpowers. And I asked everybody to have a superpower name. And mine was Dr. Ray Hala, Her Excellence. And so that is why you introduced me that way. And I want to know your name. Remind me, what is your name as well?
Yes, I also had a name. I have a name. It's Audacity, or maybe I should say Dr. Audacity.
Okay,
that's my superpower
name.
I know. I just want to use our superpower names all the time. Like, forget the regular
absolutely.
names.
Feel free.
Absolutely. Okay. I'm going to do that. So, I wanted to give you a chance to just briefly introduce yourself for our listeners.
Yeah. So my full, regular name is Dr. Raymona Lawrence, and I am a public health professor. And so I've been a public health professor for about 15 years now. And so I am at Georgia Southern University, in the Jinping Su College of Public Health. And so I, do a lot of work with community engagement in rural minority populations, specifically with, sickle cell disease. And so really enjoy working with communities, doing true engagement with communities, and making sure that their voice is heard in the work that we do. So that is me.
Fantastic. Yeah, it was so great to hear your keynote speech. It was a perfect way to spend the day before APHA kicked off, in a room full of incredibly powerful women. I mean, and it was amazing.
Yes.
So
Thank you for that.
I knew as soon as I heard your speech, I was like, I'm going to need her on the podcast. And I did actually ask you, I fangirled a little bit and asked you to take a photo with me. And so we did that too.
Well, I'm a fangirl of everybody else that was in the room as well, because I think that, like you said, there was so many phenomenal women in that room, and all of us just had such amazing superpowers that together can really make change in the world. And so I was excited to be among all of the change makers.
Absolutely. It was like there were sparks going off in that room.
Absolutely.
It was fantastic. All right. Well, I would love to jump right into our questions. So the first question I wanted to ask is about courage. And so I know you know this, that bravery is about taking action without fear, while courage is about taking action despite fear. And I would love for you to share some experiences from your professional and or personal life where you acted courageously.
Yeah, well, I can start with my personal life, the way that I even got into working with sickle cell disease is because I was born with sickle cell disease. And so the bravery that it took to navigate the healthcare system as a little child and to go into the work of academia where people told me, oh, you might not graduate from high school on time. Oh, you're not going to be able to run and play with the other kids. And I always, when I'm talking to people, I laugh and I say, when they told me that I couldn't run and play with the other kids, I always said, oh, they just don't run fast enough. And that's why I can't play with them, because they're not fast enough. And so I always had this mindset of, I gotta be brave because I didn't have any other choice, right? I was born into, you better step up if you're going to live, right? So I had to make sure that I did the things that I needed to do to just survive from day to day. I had to take, like penicillin up until I was 17 years old every single day to just make sure I didn't have any kind of infection and things like that. And so my personal story is a story of bravery. I had to just overcome things throughout my life. But then as I went into my professional career, I started my career as the wellness program director for Georgia Southern. And so, in that career, I was very happy. I got to work in this beautiful facility at the university and do wellness programming. And so, I had finished my doctorate right after I started the position, maybe a year or so after I started the position, and my doctorate was in public health. And so they had a temporary position. And that temporary position was to come over to the College of Public Health and teach. And they said, this temporary position is for 1 year and you have to quit your regular job. I'm like, I can't do this, my regular job, and do this. And it was so much uncertainty. And so I asked people, I had mentors and people that I was talking to, and they said, Raymona, you can always go back to a staff position. But if you let your research die and you just go for years and years and years without doing more research, then you are not going to be able to get a faculty position. So I thought, when I'm 60 or 70 years old, that's when you become a professor, right? That's when you're supposed to do these types of things. That was never in my mind to go into this career. And so as I was talking to people who mentored me, they said, no, right after you finish your doctorate, you need to start publishing. You need to start getting grants if you want to continue in this career. So they advised me, yeah, go ahead and do this temporary position. So I turned in my resignation for my staff position and I had a panic attack. I thought, oh my goodness, I have no clue if I'm going to be able to help provide for my family, if I'm going to have a job, if I'm going to even be able to survive in this career beyond the next year. And so people continued to encourage me and say, you can do this, you'll be okay. And so I went into the temporary position. Clearly, I ended up getting the full-time permanent position, and now am a full professor of public health in the college. And so that took a lot. It took a lot of courage and all of that, because I was coming in as someone who was not trained in research or all of the things that you need to do to be a professor. And so I had no clue if I was going to be able to make it. And so I think that is a huge example of how I really just had to take the lead, be courageous, jump in, knowing deep in my heart that I was supposed to be doing this stuff in public health, but just being so afraid of the next step. And so, yeah, that's an example.
Those are great examples. And I love that you started talking about courage that you had when you were a little girl.
Mm-hmm.
And, I'm a mom. I'm sure there are listeners out there who are moms.
Mm-hmm.
And, it just reminds me of how important it is to teach our little girls about courage.
Mm-hmm.
Because, all children are going to face uncertainty in moments and are going to feel fear in moments. And I mean, your situation, you're talking about facing that every single day.
Mm-hmm.
Children with chronic illnesses face that every single day.
Mm-hmm.
And I think that, clearly you were set up well. I mean, I'm sure it wasn't easy, but you figured it out, how to be courageous. And then look what you were able to do as you became an adult.
Yeah.
So I love those examples. It's really great. And it is, I mean, I think fear is, a lot of times fear comes from uncertainty.
Mm-hmm. Absolutely. And we have this mix of, I want to take the leap, but I'm so uncertain. And then we get stuck in the place of status quo and the things that we've always been doing because we are afraid of the uncertainty. And sometimes you just have to take the leap. And so, I really think these are important conversations because a lot of people are stuck and they want to have the courage. They need to move. They know that they need to move to the next space. They're either in bad situations or situations that are in not ideal in some way. And if they just move, then they'll be able to see the greatness on the other side. But that fear is holding so many of us back.
Absolutely. And that actually is perfect lead into the next question I have, which is about expressing your power. So, as you said, courage isn't just about taking action despite fear. It's also about claiming and expressing your power. Mm. And especially in spaces that may not always welcome it. And so I'm curious about how you express and embody your power as a woman of color doing the work of public health.
Mm-hmm.
Yeah.
Yeah. I think the very first thing is that I had to own my own power. A lot of people tried to take power from me from a very little girl. And, just like what I was telling you before is that they said, you're not going to do this. You're not going to be able to run. You're not going to. And so I had to say, either I'm going to internalize that and live up to their limitations, or I'm going to not internalize it and live up to my expectations of myself. And so that's a mindset that I've taken because as a woman of color, I have gone into many rooms where people didn't think that I was the professor in the room. They didn't think I had the highest education. They didn't think I had the most experience. They weren't there expecting me to do whatever it was that I was doing. And so to overcome that, one of my mentors always says, success is the greatest revenge. And so sometimes I have been just in the place where I put my head down and said, let me just study. And what I know is what I know, and nobody can take that from me. And so I've learned to, be up to standard. I need to know my stuff, but I also need to have these collaborations and these networks of people that can support me. And I'm a person who never does anything alone. I'm always looking for collaborations. I'm always looking for networks. I'm always looking for that village. And so we think about communities of color that often have these very rich senses of family, of village, of cooperation. And so these are the types of things that I think about. How do I surround myself with like-minded people who are able to support me when I'm feeling that I'm being disrespected in a situation or that I'm being overlooked for some reason. And then lean on them, but also learn to speak up and to speak up for myself, knowing that I am worthy of that space. And I think that's something that we're often told is that, be quiet. You're not supposed to be taking up this much space. Do these things that make yourself small. And I learned that if you can't digest me, feel free to choke, because I will not make myself smaller to be digestible for you anymore. And I think we have to really step into our power and realize that we stand on the shoulders of giants. And so if people who had all of these things against them can make it, so can we, right? So when we build on community, we change our own mindsets. We stop letting people that are external validate us and say that we're worthy. No, your opinion of my worth is not changing what my worth really is, right? Just because you don't know or you don't recognize the value of something doesn't mean that it's not valuable. It's you that is the issue, not the value of the thing. And so that's what I've learned, is that how can I make sure that I am nurturing the value that's in me, so that then if somebody doesn't recognize it, it's their loss. They just went by something treasured and valuable and they lost. My value didn't change. So those are some of the things that I do and how I've really tried to change my mindset over the years, because often, and even in the climate that we have now, politically and different things like that, we think, oh, this is happening to me. And it is. But also it's the mindset of people before me have been resilient. They have gotten through things. They have gotten through a lot of tough times, and so can I. And so those are the types of things that I try to do as I'm facing challenges and I'm facing these situations where people don't value me and they think that I'm not worthy of a spot at the table. I know that I am. Yeah.
Wow. Yeah. I wanted to I'm not a very good snapper, but I wanted to give you snaps multiple times throughout what you were saying. And I keep imagining you as this little girl saying, yeah, the other kids are going to have to run faster to keep up with me.
Mm-hmm.
Yes.
Yeah.
And yeah, I mean, taking up the space, I think is critical. And we're not taught that as women, and certainly women of color, I think, are often, that's not the message that women and women of color get from society.
Absolutely not.
It's not. And we get to change that.
Mm-hmm.
We all get to change that.
Absolutely.
Yeah. So I'm really interested to hear about your vision for the future. And I'm thinking about vision in multiple contexts. So, the vision for public health, the vision for BIPOC communities, and your personal vision as well. Where do you want to go? Where do you want us to go?
I really would love to see, especially women of color, be the CEO of their academic and their personal life. Often we think of ourselves as this worker that is just doing all the things. We can't have support. We got to do everything on our own. We're not building the boundaries that we need. We're not taking in the rest that we need. We're not building those communities of support that I talked about earlier. So how is it that we become the visionary and we say, it's the who, not the how, right? So I read the book with Dan Sullivan and Benjamin Hardy, It's the Who, Not the How. And they talk about this fact that there's so many things that we can accomplish. There's so much that we can do, but we are thinking about the how all the time. So we keep ourselves from accomplishing things because we think this is how I need to do it. So he was talking about, I wanted to write a book and I thought I had to write the book. But no, I met Benjamin Hardy, and he was the person that could write the book. I had the ideas, and this is Dan Sullivan talking, and he was the person that could write the book. And so this is what I think about in so many different situations in our lives. We want to accomplish things. We want to run businesses. We want to have the academic careers that we want, but we're so stuck in how we have to do everything and how we're going to make it happen and how we've got to take another course and do another thing to learn more and to, take up more time, that we forget that we are the CEO of our academic and our personal life. And so what we need to do is think about who it is that we can partner with. Who has the strength that I don't have? Who has the superpower that is going to help me with my superpower, right? That's going to collaborate, that's going to partner so that we can have superpowers, right? So we've got to start thinking about those types of things. So that is my vision, that we are in a place where we are moving through life with more ease. We're moving through life with rest. We're moving through life in ways that are not tearing our bodies and our mental health down, that we're able to take up space while we are also taking rest. And so those are the types of things that I really see. For public health in general, I see that this field is going to be elevated. I think people are starting to learn the value of public health, and public health is like the person that I talked about earlier. Like, no, people don't see the worth. And then they're like, who are these people? What are they doing? And we are valuable, right? Regardless of what other people have seen or said. And so now I see this resurgence of public health where people understand the value that we bring to their lives in every part of their life. They understand that public health is essential in everything, and that this field, this career is really elevated in a way that we're incorporated into every aspect of life. And so I see great things for public health. I know that we are in a situation now where it feels like we are being cut, being attacked, all of these different things. But I think that on the other side of that is always resilience. It's always this comeback. It makes us more innovative. It makes us more savvy. It makes us where we invent new things. And so it's always, what am I learning? What's happening in this phase? And how do I just come back even better? And I think that's what's going to happen with public health. I think that's what's going to happen with people, even though we're seeing the suffering now, we're seeing the loss of jobs, these things. I believe that everybody is going to come back stronger.
There's so much hope in that. I mean, that's, yeah. And I think we have to have hope. Mm-hmm. We need to believe that we can change it.
Yep.
Change things for the better, and then we just go do it. Like, we believe that that's possible and that that's what's going to happen, and then we just go do it.
Yeah.
I remember in your keynote speech, you talked about, being a human being and not a human doing. Mm-hmm. And it's funny because I had recently just heard the song called Human Doing by Carly Pearl, which is exactly about that. And so it's a song that I listen to all the time to remind myself that it's about how I show up. It's about how I be, right? Not what I do.
Exactly.
And, I think that's a really good reminder as well. And yeah, I mean, I want to see the same things for public health, you know. It's possible. It's absolutely possible. So what about for yourself? You have any specific vision for yourself? What's next for you?
Well, I am in public health. I also have a business. I love systems and operations and really supporting women and minority business owners. And so my goal is to partner with people who are creatives, who are academics, and make sure that they have the operations and systems that they need to be able to run their businesses. And this is the way that I disrupt things. I always say, choose your disruption. So I am excited to be a disruptor of the economy in a way that we're lifting women and minority businesses up. We are giving them the foundation that they need to thrive in the economy and to give back to their communities. And so I own the Systems Boutique, which is the agency that I run that helps women and minority business owners with their systems and operations. And so leading hundreds, thousands of women into spaces where they are financially free, where they are able, like I said, to give back and to enjoy life, to rest, as I was saying earlier. So that's my vision. I think that if I can do that and help people who they might be in academia, they may be just business owners that are totally separate from academia. But how do we bring these women in to places where they're empowered and they're able to reach their own goals? And so I think I'm moving out of the point where I have to accomplish things and I have to do more and I need more accolades. I want to be the person in the back end that supports other people now. How do I help you to get where you want to be? That's the place that I'm in now. I've done the things, not that I've done everything that you could possibly do, but I'm in a place where it's not about me. It's not about me anymore. It's about me helping somebody else be their best self. And that's what I want. That's my vision.
That is so beautiful. I mean, you've done this incredible job of lifting yourself up and to then be able to turn your attention to other people.
Yeah.
It's just beautiful. It's just lovely. And I know that you talk about disruption. What's your disruption? And so I just wanted to tell you that I'm wearing my disruptor necklace today.
Oh, I love that.
Yes. I have a bunch of necklaces with words on them. Instead of getting my name, I just get words that, that are inspiring to me. And so when I was going through every morning, I get to go through my necklaces and decide which one to put on. And I was like, oh, it's Raymona. So I'm going to put on my disruptor necklace.
I absolutely need to know where to get that from because I will wear that every day.
Oh my gosh. Yes. Well, I appreciate you so much coming on the podcast and for all the work that you do and the generosity. You're generous and you've got this spirit of just kindness and compassion and generosity. And
thank you.
Those are ways that I value being, and I want to be those ways as well. So it's really lovely to connect with you. And yeah, let's go disrupt. Let's go do some more disrupting.
Choose your disruption, whatever that may be. I think that's the word of the day is how do you make sure that you disrupt things in your own way? And that's what we want to do.
Beautiful. Thank you so much.
You're welcome. Thank you.
I value that conversation so much. Dr. Lawrence's work reminds us that disruption, when fueled by courage and compassion, is a powerful force for lasting transformation. I encourage you to connect with her to learn more about her and her courage. You can find the links to connect with her on the show notes page for this episode, located on our website, courageouspublichealth.com, under episode 3. Before you go, please take a moment and share this episode with a friend. I know you have people in your life who would appreciate hearing this conversation about courage. If you're listening in a podcast app, you can easily share this episode through a text or directly to social media. On the show notes page, you'll also find social media sharing buttons to make it super easy to spread the word. All right, everyone. Until next time, stay courageous. Thank you for listening to the Courageous Public Health Podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.